Thank you guys so much for joining us. You know, I just want to first start out and thank Oklahomans, our healthcare providers. I went and took a tour of one of our hospitals yesterday and met the doctors and nurses that are on the front lines, and they are doing a fantastic job. So thank you to them and our first responders. Also, our business community. We're doing a great job of innovative. Oklahomans are taking this seriously. The recommendations from the CDC, I'm hearing from all over the state. We are keeping gatherings below 10 or more. So thank you for everything that you're doing. Today we're here, and I wanted to announce on Friday we launched the Governor's Solutions Task Force. This group is made up of experts in their fields and is designed to help us with the comprehensive response to COVID-19. We've created a dashboard with data points that we're gathering on a daily basis. This is up 24/7 now. We are gathering PP&E from all the different hospitals, so we know exactly what hospitals, their lead times they need, and exactly how much PP&E they have in their stock. We are collecting ICU bed counts. We've got the hospitals with their surge numbers. We have ventilator numbers, and we're tracking this on a daily basis. The state epidemiologist is modeling several different scenarios for our state as we're preparing for surges in our hospital use and also all of the available equipment that we're going to need. We'll be talking about that a little bit later on. I have four goals for Oklahoma. My first and number one priority is to protect the health and lives of Oklahomans. Number two is to mitigate the impact to Oklahoma's economy. And number three is to position the state to fully recover from this crisis as quickly as possible. Number four is to continue our desire to achieve Oklahoma's full potential to be a top 10 state. Yesterday, I signed an executive order that did three things. Number one, it allowed Oklahoma State University and Oklahoma University's research departments to set up lab testing. Number two, it allowed us to cut red tape to reissue licenses to get nurses quickly back on the job. Number three, we restricted 2 drugs that were mentioned as possible treatments to keep folks from hoarding them. And let me be clear, there are certain chronic illnesses that people need this, like lupus. This is the reason we signed this executive order to make sure that those that they have had availability for that drug. This week, we will have 4 mobile testing sites up and running around our state. We will have donation sites up and running for PPE to be donated from our manufacturing facilities, from our different citizens. Unemployment claims we're tracking very, very closely. We have seen a huge spike in unemployment claims, almost double what we saw last week every single day. And my heart is breaking for the Oklahomans who are struggling, who have lost their jobs due to no fault of their own through this crisis. So we have waived the waiting period to get unemployment benefits. We have pushed back the tax filing deadlines to match the federal IRS guidelines. Small businesses all across our state are struggling. So we can announce today that the Small Business Association, you have the ability to apply for low interest loans and also help. The rumor that we have activated the National Guard to shut down the borders is simply not true, and I'm going to let General Thompson address that a little bit in a second. But I know that Oklahomans are fearful and anxious in this uncertain times. We're all dealing with a little bit of anxiety. And I just want you to know we are going to get through this. We're going to get through this together, and I just want to encourage Oklahomans to continue to follow the CDC guidelines, the social distancing, the innovation that businesses are doing all across our state. They're doing a really good job. Churches are mobilizing, church online. Businesses are continuing to think of innovative ways to continue to serve their customers while we're still respecting the CDC guidelines. So thank you for that. Continue to innovate, continue to do that. Let me turn it over to General Thompson for a couple comments.
Well, good evening, everyone. Thank you, Governor, for allowing me to be a part of the panel and talk about some current events. It appears to be a lot of interest related to the Guard and the role that the Guard will play as this pandemic plays out. And I just want to assure the people of Oklahoma that the purpose of the Guard, the reason the Guard exists, is to deploy and to help Oklahoma in this time of need. If you allow me just for a moment, just in my lifetime, in 1973, we had a huge prison outbreak in McAllister. The Guard was called out to stand beside correctional officers and Oklahoma State troopers. In 1999, we had the May 3rd tornado. In 1995, we had the Murrah bombing building, which shocked not only America, but our country as a whole. In 2005, the Oklahoma National Guard flew over northwestern Oklahoma and dropped hay bales for farmers who are afraid their livestock would starve to death without some help. In 2015, we did the same thing. In 2013, we had the May 3rd tornado, or the May 20th tornado in Moore, Oklahoma, which horribly, horrifically hit an elementary school, and it was heartbreaking. The Guard was there to safeguard that community and serve that community. Less than a year ago, in 2019, the Oklahoma National Guard had up to 500 members on active duty to help the community of Tulsa, Fort Gibson, Sand Springs, to fill sandbags and to walk on levees 24 hours a day to watch the levees to make sure they didn't break and endanger the communities that lived in the vicinity of those levees. And so I can go on, but I won't. My modest point for mentioning all of that is there are two things in common when the Guard deploys. Number one, they deploy when Oklahoma needs us. And number two, from everything from a prison riot to dropping hay out of the back of a helicopter, we are never in charge. We are always there to support the governor or that community in need. And that will be no different here. If the Guard is called out, the Guard is called out to help Oklahomans in their time of need. And I'll yield my time to Secretary Lothridge.
Thank you, General. We are indeed taking action, and among those actions, in addition to the 4 satellite locations for testing that the governor alluded to, we will also this week be standing up a new platform in partnership with Google that will facilitate the screening for all Oklahomans. Details on that will be available this week. Additionally, we all know and have been advised that COVID-19 hits most severely those individuals over 60 years of age. But our data here in Oklahoma indicates that most of our positive cases are in the 18 to 49-year-old cohort. What that means is that our actions, each of our actions, impact folks in each age range. And therefore, our call is for that of personal responsibility. Social distancing works. It is our single most effective means of muting transport of this virus. And so we continue to encourage Oklahomans to exercise social distancing alongside personal hygiene. We need everyone to focus on these measures to make sure that we're safe, because if we're not safe, no one is, including our healthcare workers, which Dr. Shrum will allude to in just a moment. If you must go out in the community, either for work or for essential services, be mindful and aware of your risk and your role in helping stop the spread of the disease. We reiterate our crucial recommendation not to visit nursing homes, retirement centers, or long-term care facilities, as these populations are particularly vulnerable, and they rely on us to protect them. At this point, I'd like to introduce my colleague, Casey Shrum, both Secretary of Science and Innovation and President of Oklahoma State University's Center for Health Sciences.
Thank you, Secretary Lothridge. and good evening. First, to our healthcare workers, our physicians, our nurses, paramedics, and all of those on the front lines, thank you. We greatly appreciate your service during this unprecedented pandemic. We're working hard to address the needs of our frontline workers so that they can do what they do best, and that is take excellent care of Oklahomans. In order for us to have an appropriate response to the COVID-19 pandemic, we must have the capacity to test additional populations. In addition to having adequate protective equipment for our frontline healthcare workers and having hospital beds and ventilators for those who might need them. Through the governor's executive order, we should be able to expand our testing capabilities within the state by utilizing both OU and OSU's research laboratories for testing by the end of the week. If our labs are running at maximum capacity, we will be able to test an additional 10,000 Oklahomans. At OSU, we can run up to 2,000 tests per day and have results within 24 hours. That means we should be able to expand our testing capability by tenfold by the end of the week.
Thank you, Dr. Shrum. We'll open it up to a few questions.
Let's start here in the room. Governor, any more thought to taking further action to restrict businesses in other cities? Many cities have closed down restaurants and bars, and some say they're not, and some have actually said they're still taking their lead from you.
At this time, no. We're following CDC guidelines, and that is to stop groups of over 10 or more, and the social distancing that Jerome talked about. That's what the CDC guidelines are. That's what I'm going to continue to preach. And you know, the question is, if you when you shut down something, when does it come back? We're looking at modeling that this could go on for a while. This may be the new normal, and that's why I'm telling businesses they've got to innovate. We've got to think about how do we deliver services, how do we go to the grocery store. That's why I'm so proud of, I've been having conversations with all the grocery store association, the restaurant association. They're now opening up an hour early for our elderly population, right after a deep cleaning of their facilities. And so we just got to be innovative. And we're hearing that all over from the different business communities, and that's my message to them.
What's the line between social responsibility and the role of the government to say, hey, we need to not do this? Here in Oklahoma City and Norman, Tulsa, executives there have said we need to close down these certain facilities. At what point does it get to where you have to make that call? I mean, does that make sense?
Absolutely, but you know, we're following the CDC guidelines, and let's be clear that our fact pattern is different in our state than it is in New York City or it is in Los Angeles or Chicago, and we're hearing this stuff on the news and sometimes reacting to it. We have the epidemiologists who are focused on telling us when our surge will be. We're modeling those factors. There may be a time that we have to do other things. That time is not right now. And again, the CDC guidelines are a recommendation to have groups of not more than groups of 10 or more. And from what I'm seeing, the churches and the businesses are doing that on their own and being very responsible. And so that's why I'm so proud, and that's why I want to keep reiterating that to the business community, to be innovative, keep following the guidelines of the CDC, and that's our recommendation at this time.
But it sounds like you're saying that there could be a time when that has to happen, and it sounds like you're saying that if the state's epidemiologists were to come to you and say, hey, we're starting to see more community spread in some of these places, Woodward, Guyman, wherever it would be, that don't have currently confirmed cases. If the state's epidemiologist came to you and said, Governor, it's our recommendation that we have all these restaurants and bars close down, theaters, is that when you would do that?
You know, it's a possibility. I mean, everything's on the table as we're in uncharted territory. This is changing so rapidly as the CDC gives more recommendations to us. So we'll take that as it comes, but we have 66 cases right now in the state of Oklahoma. We're monitoring that really, really closely. what we're focused on is taking those modeling numbers and then forecasting and making sure that we're prepared for hospital, for ventilators, for the PP&E, for all the different, for the hospitals. And so we'll take that as it comes. This is early on in this cycle. And again, that's my message right now to Oklahomans is continue to be innovative, continue to follow the CDC guidelines, and we can get through this.
We're going to take some questions from the conference call. If you could just repeat the question so the viewers at home could hear as you answer. Let's go to Erica. Erica from KWTV, do you have a question? Erica, go ahead. You should be open. All right, we'll work on that. Ben, you got something?
Yeah, and this may be a question for Secretary Lowridge. You had mentioned that here in Oklahoma, we're seeing some of the more severe cases in that 18 to 49-year-old range. Is there any theory for that, or that you can pinpoint?
I'll defer to our state epidemiologist as to any particulars there, but just to stipulate, we are seeing incidents increased in that. Our majority of incidents is 18 to 49, not severity. Those are important distinctions to bear. But I don't think we know enough yet to postulate around that. But that goes to the governor's point that the data that we see that derives specifically within our borders differs even from that which we've seen in New York, California, and elsewhere.
So I would add to that what we are seeing a higher incidence in that area, but then we have not changed the high risk, which is those over the age of 65, those that are immunocompromised, those who have chronic conditions. So while we are seeing more patients in that age range, the higher risk population is still the same.
Dr. Shrum, if the state epidemiologist came to you and said, hey, I think we need to take some more measures to shut down restaurants and bars and theaters across the state, what would be your recommendation to Governor Stitt?
Yeah, so I think that we have to remember that where we are right now, we're all talking about flattening the curve, right? And everybody's familiar with that term. We are right now in the mitigation phase. And so what we have to remember right now is that what predicts our curves is what we do today in following the CDC guidelines and staying at home, our social distancing. And as we watch those, what we've been working on over time is saying, what are the triggers that will be put into place? And we have to watch those and those indications. And as we move out of the mitigation phase and we're monitoring our cases and our testing increases, there may be a time when we make that recommendation to the governor.
Could you give an update on some of the data that we have in terms of PPE and ventilators and some of the hospital capacities?
Sure, we have really two distinct issues. I'll speak to that, which has gained a great deal of currency recently, which is PPE. That's personal protective equipment. This is vital for the health of our healthcare workers. As Dr. Shrum has alluded to, that is of preeminent importance. It's front of mind to us, those frontline workers and their protection as they care for those who are ill in our institutions. As we stand right now, we track this daily in 7 to 8 major categories. In an aggregate number, we have roughly 9.3 days of PPE on hand. There is a supply chain that has worked both from the state side and from individual institutions that feeds into that. We are also monitoring each of those pieces along the way. But as we stand currently, 9.3 days worth of PPE on hand. I'll defer to Dr. Shrum relative to testing and the like.
So as I said before, testing is important. Our highest priority will be healthcare workers, those that are hospitalized. And the reason for that is as we have patients that have pending labs, it takes longer for us to know, do we need to be utilizing protective equipment? So we want to be very efficient in our use of protective equipment. We also want to know if our healthcare workers are exposed quickly. We don't want to have to quarantine them for 14 days. And then as we move into expanding our testing capabilities, those that are at the high risk population, then next would be targeted for testing. But those two things really go hand in hand. Having adequate testing to be able to know what patients we need to be utilizing the protective equipment on is key in efficiently utilizing the protective gear that we have. You should know that, this is a phenomenon that nationally everyone's experiencing, and so in Oklahoma, we're looking at what we can do to ensure that our healthcare workers frontline, their safety is a priority, so that we can keep them working and taking care of Oklahomans.
You talked about the preparations for rural hospitals, and there were some questions coming in from our reporters about how you're preparing in rural areas with less access to care and maybe fewer items like ventilators.
Sure.
Go ahead. Yeah.
Sure. A brief comment, and then again to Dr. Shrum, but we are in close coordination with all of our healthcare providers to include the hospitals. Focus has certainly landed on Oklahoma City and Tulsa, but we are in daily conversation as well with our rural healthcare providers. They've been exceptional with respect both to joining the effort around PPE, but also in their own preparation. Each of these institutions has their own emergency contingency plans. They are all well down the path of preparation and making those happen at an appropriate time. So I would say our rural hospitals, which comprise a great number of our institutions in this state, stand on a very good footing.
I support what Secretary Lothridge says. We are in communication with our rural hospitals. They're putting in their information into our system to be monitored as well, and we are tracking our incidence of positive results on a map, so we can see what's happening by county, and we know which hospitals are in those counties, and we can look at what equipment they have and what protective gear they need as well.
General, there have been a lot of rumors going around about the National Guard's at the Tulsa Fairgrounds, the National Guard is here and there. Could you just speak to the scope of the National Guard operation right now in terms of this task force?
Sure, and I'm glad you mentioned that because I got a call today about the National Guard being at the Tulsa Fairgrounds. The number of folks that we have, members of the National Guard that we have mobilized or activated for this emergency is 19, 17 Army National Guard and 2 from the Air Guard. And I just want to reassure our viewers or the people that live here in Oklahoma, when the Guard comes out, it's not like it's some nameless, faceless bureaucracy. It is your neighbors, it's the people that you go to church with, it's the people that you go and watch softball games with, it's your sons and your daughters. It's people that live in Oklahoma who are coming out to help Oklahoma. So the whole concept of that some bureaucracy is going to roll into Oklahoma to take over Oklahoma is just not based in reality. And I'm glad that you asked that question.
Governor, is there any talk, or whoever would be the best person to talk about this, the idea that there are surgery centers, there are other places that may have PPE that are using those that may have chosen to stay open. Does there come a point where you either call on the phone and ask nicely, or you take out your executive order pen and order them to hand over that personal protective equipment such that the 9.3 days can be expanded?
Yeah, I think there's certainly a point where we would either by executive order or recommendation limit elective surgeries. First, you have to make those decisions based on what is our supply of PPE, what is the epidemiologist telling us that we're going to have the spike, how much we're going to need. So there's some data to gather before you make that decision, but that's certainly something that we've discussed. There are certain hospitals that have already limited elective surgeries. So it's something it's something that our team is considering and we're watching very closely. But we have to get our arms around the data. Again, we're going to make our decisions based on the data that's in Oklahoma on what's best for our state.
Governor, you mentioned 4 mobile testing sites coming online this week. Does anybody have any details on where those would be located and what that would look like here?
Yeah, so the 4 mobile testing sites, I think one's going to be in Kay County around Ponca City, one's in Tulsa, one's in Oklahoma City, and then I believe the 4th one will be in McAllister.
Do you, can we get a little clarity on who's in charge of the strategic medical reserve, I guess is what it was referred to the other day, the PPE that the state had. I've heard some talk that maybe the U.S. Public Health Service folks have, in their region. Oklahoma's in one of several states in the region for the USPHS. But does the state also have its own PPE stockpile? And then can you speak to how much of that is actually usable? I know that in other states there have been situations where the elastic had fallen apart on masks.
Yeah, and I'll let them jump in as well. But so our state does have a strategic supply, and it's owned by the Department of Health. The federal government also has a strategic supply that they will deliver to the states pro rata. We've been in touch with our federal delegation as we've got our first shipment in to help with our overall supply. It's in Oklahoma City. It's at a warehouse. It's under Dr. Shrum. She's in charge of making sure she gathers the need from the hospital. So we're setting up a process to where hospitals can let us know when they're critical. And so she's done a great job. We put together a green, yellow, and red on, and then we've tiered the hospitals and their need based on their ICUs, based on who they're seeing on positive patients. Let me turn it over to Casey before I mess it up more.
That was a very good description. Yeah, so what we have been looking at is, how do we go about deploying PPE? We want to make sure that we're getting the resources to the right place. We want to make sure we're monitoring that. So we have set up a database, again, that looks like a map. It has all of the hospitals in the state that are in that database. And each of the hospitals, based off criteria, COVID-19 positive cases, nursing homes, how we have identified which hospitals need that the most, those hospitals would be placed in a tier 1. And those hospitals we want to keep on green, which means if a hospital that is a tier 1 falls into the yellow range, we will be notified. And then that hospital, we want to make sure that at this point, we want to make sure that hospital has at least 7 days of PPE on hand. And if they're a level 2, it will activate at different times based on where they are. And so that's a system that we have put in place to monitor the state. In addition, again, that same screen when you're looking at it is a map of the state that lights up positive for counties that have had cases. So it gives us a real-time look at what's going on. It gives us the opportunity to reach out to those hospitals if we need to further understand what their need is.
Got a question.
I'm sorry, real quick, Charlie, about is any of the state's strategic supply, is that still usable? Are there repairs underway on some of the masks that may have deteriorated over time?
Sure, we're bringing all those into bear, and I'll yes, as a short answer. I'd also highlight something that Oklahomans are doing increasingly. When the governor and I were at Integris yesterday, they were receiving word that folks were distributing patterns, those who are capable of and inclined to sew patterns for exterior surgical masks, not the N95 mask that's the primary healthcare worker mask, but those surgical mask ear loop that can cover over those and extend the life of those N95s. Oklahoma residents are stepping up, and those who are capable and have shown an interest are actually sewing those to spec and then providing them into the medical community. That is an innovation of the type that we think that Oklahomans are uniquely able to make, and we're proud that we see things like that happening already.
Governor, just Dylan from KOCA wants to know, what's your message to Oklahomans who see 67 cases? And I think that doesn't sound like a lot, but do the experts have an opinion on how many the actual number might be? Maybe Secretary, you can talk about that.
Listen, we are going to take this very, very seriously. We're going to follow the CDC's guidelines. We are looking at modeling, and we'll share that with Oklahomans. We've got to continue to practice social distancing. This is something that we're seeing affect other countries, and we're watching what the fact pattern is in our state. And yes, we have 67, but we also were a little bit behind our first case for some other states. So we have to be proactive and look at that surge, and that's really what this whole task force and our solutions task force is focused on.
I would add to that as we increase our testing, we know we're going to increase our positives. It's important for us to be testing so we know what is going on. Currently, we have 67 positive test results. And you know, we have tested probably just over 700 individuals with test results back. So that tells us when we test, you know, we have the capability to test 10,000 more Oklahomans, we're obviously going to see, you know, those rates increase. But again, I think we have to go back to remind Oklahomans that we are in that mitigation phase right now, and social distancing, staying at home, washing our hands, all those things that the CDC guidelines are saying to us sound very simple, but they're so important right now because we want to limit the spread. And so that is our way of flattening the curve. And when we flatten the curve, it allows our healthcare system to take the capacity of those new cases over a period of time. And that's what we're really wanting to do right now.
And I want to underscore one thing that Jerome talked about. Oklahomans are stepping up, and this is a request for manufacturers, for business owners in Oklahoma. The PPE, we will have some transparency around what we've ordered, what we have in our supply, and we'll get that out there. That's what we're gathering through this Governor Solutions Task Force. One company I want to highlight, Prairie Wolf Distillery, right here in Guthrie, Oklahoma. They switched their manufacturing, and now they have manufactured the hand sanitizer, enough to put an 8-ounce bottle in every single Oklahoman's hands. That's the type of innovation that we need if the supply chain continues to be disrupted in the future. And so that's the mask that we're talking about. That's the protective gowns. And so manufacturers, we will be letting everybody know what we need and kind of be transparent with our needs on the PPE, or PPE, sorry. And let everybody know what we need. That's why we're setting up the donation facility that the National Guard is setting up at a couple different locations to get some donations.
Can you talk about the state budget real quick, just with the crisis, and is the rainy day fund going to be needed? That was from Rick with Fox 23.
So the state budget, this year we're in fiscal year 2020 through June 30th, and it's possible we could have what we call a revenue failure. We are working with the House and the Senate to how we would address that. The great news is last session we saved $200 million. We were very fiscally responsible with the taxpayers' dollars. Even though we had a budget surplus last year, everything looked rosy. We have the largest savings account in our state's history. That's significant, and it's going to help us get through this down time. That's why it's so important to save in the good times. So we'll be able to use some of the rainy day or the stabilization fund to get us through 2020, and then as we're working on the budget for fiscal year 2021, we'll continue to do that as well.
This sounds like a real premature question, but you mentioned one of your goals is a healthy state economy rebound when this is over with. Have you given some thought to what that may look like? You know, what you'd like to see the legislature do? I mean, what's that goal look like for you right now?
Well, we're in the planning stages right now. So I have assigned out kind of 6 pillars. One of those pillars is, what does it look like when we're in phase 2, when we're past this, when we have this in the rearview mirror? How do we get Oklahoma's economy going? That's one of the pillars. The other pillar is, how do businesses innovate right now? And so those are some other recommendations that I have Secretary Copeland of the Commerce Department working on right now that I want to share with Oklahomans, because we have some of the most innovative entrepreneurial minds. We have to continue to go to the grocery store. We have to continue to go to church. And so do we do that online? And how do we do those things safely while we keep business going and the employees there? Because if this is going to be a drawn out process, we've got to this may be the new normal for a while. And so that's my directive to Secretary Copeland, to let businesses know, here's some ideas, here's some things, and then we want to hear from businesses as well. Like restaurants, for example, they're doing the curbside, and businesses are letting their employees work from home, or their critical employees that have to be there, they're separating cubicles and they're practicing the social distancing that is going to mitigate the spread of this in our state. So That's what I mean by those. We aren't ready to release those yet to Oklahoma, certainly not the phase 2, but we are working on it. That's what I wanted Oklahomans to know, is those are my 4 main goals. But number 1 is really just to protect the health and the lives of Oklahomans. So that's why we're taking this seriously. That's why we're gathering this data to make sure that we're prepared for whatever may hit our state.
Do you ever see a statewide shutdown, Governor? This is from Ted Monty with Channel 6. Do you see a statewide shutdown like other states are doing, and when would that be needed?
Again, right now, the answer to that is absolutely not. This is something we're looking at the CDC's guidelines, and I know that we're hearing stuff that's happening in New York City, in California or Chicago. We have a different set of facts here. That's why we're getting prepared for what when our spike possibly could be. I'm not saying it couldn't happen sometime in the future, but right now, that's not the decision of the state. That's not the recommendation of the federal government or the CDC to mitigate the spread in the state of Oklahoma.
There was a change this past week in the state epidemiologist. There was a transition. Can you discuss the impetus for changing people in that role?
Sure, happy to. Yes, we had, in fact, what we've done is we have flexed up the State Department of Health. We're obviously in uncharted territory, unprecedented time of emergent response. And so we've actually flexed up the number of professionals, particularly on the epidemiological team, which I won't try to say again. We have flexed up the number of EPIs across the board. And so that includes those who are working on immediate response, and as well those who are working on modeling. And we have, among those things, we have pushed some folks who had previously been working in Oklahoma City out to our counties. It's vitally important. Remember all 77 counties in Oklahoma. We operate through 66 discrete county health department locations, and they need to be touched as well. Those are going to be the places that a lot of Oklahomans come for service, for testing, and we have to make sure that they're getting messaged, they're getting serviced out of Oklahoma City. And so we've actually flexed up, and a lot of folks are taking on new roles, both within our health department. And I would also say that across the state government, folks are stepping up in truly extraordinary ways. And they are taking on roles they've never had to take on before. Their expertise permits it. We've never called it before. People are doing this while teleworking, while working a lot of hours. And so I'm extraordinarily proud of the response of our state agencies across the board and how they've done. But I would highlight that EPI team within our State Department of Health who have really answered the call in the last days.
Governor, you talked to President Trump about the supply chain nationally. They're saying grocery stores have been depleted. Do you want to say anything about what you've heard on that and tell Oklahomans what they need to be buying and not buying?
Well, yes. So President Trump specifically told the governors in several different calls that there will not be a disruption in the supply chain for groceries. So the manufacturers will be in business, the distribution chain, the big box stores. So there's no need for Oklahomans to stockpile, months worth of anything. And we've heard about toilet paper and the different stuff. But that supply chain will not be disrupted from the federal level. That's straight from the president. So you do not have to worry about that. We will not be closing grocery stores, or from a national level, President Trump will not disrupt that supply chain.
Last question right here, Ben.
Governor, I know you said that, compared to some other states and cities, our numbers may not be quite as high. But just to reiterate, this sounds like this week testing is going to ramp up quite dramatically. Are you so we're expecting to see quite an increase, I guess this is a question for the Secretary as well, quite an increase in the number of positives this week. I mean, is that your expectation this week based on the number of the increase in testing we're about to see?
Sure, yes. The more we test, the more positive we're going to get, and we're tracking that closely, and that's the reason we have the modeling in place. And but sure, we're going to get more positive tests in our state.
You said modeling. I mean, you probably won't say a number, but I mean, you have a ballpark of what you're expecting, that you at least reassure Oklahomans, hey, we know this number is going to be hit, or this is where we're going to be.
We are looking at modeling. We don't have a specific target amount that we're expecting to come back. You can look at what we've currently tested to our positives, and we expect, cases will increase. You can look at other states where over a period of 6 days, cases doubled, or 2 days, cases doubled. We need to, after we get a good pattern of testing, we get these 10,000 tests, we'll be able to see a little bit clearer how quickly we anticipate that our cases are increasing.
Thank you, everybody.
Thank you.